like to take you back to a July day on the shores of Lake Superior in northern Wisconsin. My dad, an ophthalmologist, arrived home from work, and after inquiring about my day on the pipeline, my summer job, he asked me if I'd like to help him take Queenie's eye out. You see, Queenie was a cow of a farmer friend of ours. She had run into a barbed wire fence and gotten a severely infected eye that needed to be removed. I said, "Sure, I'll help you, Dad." And off we went to Jerry's barn. As we arrived, Queenie was being wrestled into a milking stall. My dad was able to inject some Novocaine into her eye socket, and almost immediately she seemed to quiet down. She knew that my dad was there to help her. He proceeded to remove her eye and pack her socket with antibiotic gauze, and as he was finishing up, I looked over into the corner of the barn where our tough old farmer friend was standing. He had tears in his eyes. And I thought to myself, if my dad can do this to a cow and make somebody feel that good, just imagine what he does with people every day in his work as a physician. That was the day I decided to pursue a career serving people as a doctor. I think as we go through life, we should speak less and listen and observe more. I observed that day. I've always been a dream big, pursue the improbable, change the world kind of person. You see, on the day of my Queenie experience, I was on my way to becoming a high school biology teacher and a basketball coach. I knew that pursuing medical school would require a whole new level of academic excellence, long hours, and much hard work. But what I saw in my dad that day awakened within me a passion to serve the world in a different way as a physician. I would also come to find out that becoming a doctor wouldn't be without hardship and much struggle, but it also wouldn't be achieved without the pursuit. I was reminded of a book by John Ortberg titled, "If You Want to Walk on Water, You Have to Get Out of the Boat." I was getting out of the boat. My Change the World philosophy has a caveat. Life is about relationships, and we don't do this alone. If you think about the changes in the world throughout history, these changes occur mainly through relationships built. Think about George Washington and the founders of our country, Martin Luther King Jr. and the Civil Rights Movement, Nelson Mandela in South Africa, Mother Teresa on the streets of Calcutta, Jesus changing the course of history with a band of 12 characters who weren't exactly the elite and educated of their day. All these people gave up self to chase something bigger. I think that change most effectively occurs when an idea of truth is embraced and acted on by people from across all walks of life. This idea, through its inclusiveness, naturally prevents walls from being erected. The idea can become a movement or even change the world, but it all starts with relationships. And we don't do this alone. Speaking of relationships, I was at a physician leadership dinner about a year ago, and I was talking with Casey Cowell, and we were on the topic of obesity. Casey asked, "Where are the doctors in this obesity issue?" And I thought to myself, where am I in the obesity solution? You see, obesity has many causes. Fast food, too much sugar, not enough exercise, genetics. We see the effects of obesity: diabetes, heart disease, high cholesterol, lost work days because of illness, increased healthcare costs. In our country, 35% of adults and 17% of children are obese, and that number continues to rise year after year. I think that we need to look at this a different way, and we need to consider chasing health and working to prevent disease. We have a tendency in our country to get sick, and then we want a quick fix, or we start to deal with the problem. We get ill and we want a diet, a pill, a surgery, something to cure us quickly. We have a solution to that, or at least a partial solution. A solution that involves physicians, but it also involves you. We have a new vital sign. 150 minutes a week, and physicians will lead. The American Heart Association recommends that we all get 150 minutes of aerobic activity per week. Aerobic activity is defined as any activity which results in us breathing more heavily than we do while sitting at rest. So just walking 150 minutes a week. That's 5 days a week, 30 minutes a day, 150 minutes a week. Imagine what our culture would look like if all of us walked just 150 minutes a week. And where are the doctors in all this? We're engaged and leading the charge. Think about our community right now. Think of the number of your physicians who ski in the Vasa ski race, ride in the Iceman bike challenge, run in cherry festival races, or just kayak, skate, paddleboard on a regular basis. Just last month, 2 physicians, Jeff Wensloff and Dan Madian, ran in the Boston Marathon. So doctors are engaged. How do we get to this 150 minutes a week? How do we change our culture? How do we get to chasing health? I think part of the answer to that comes in messaging and branding. I think that we can do a better job in healthcare with messaging and branding. Think about diabetes just in northern Michigan. There are many well-meaning organizations, hospitals, insurance companies, physicians dealing with the problem of diabetes. I can go into a YMCA, my hospital, my doctor's office, a school, church, even a grocery store, and see notices and messages about living with, preventing, or treating diabetes. The problem is that all of these have different logos and different wording, and the message is just a little bit different, and so it's not quite as effective as it could be. Think about the messaging and branding successes in our country. Apple, Disney, Nike, McDonald's, Sparty, and the Block M. With each one of those, there's a specific logo and consistent wording and messaging. If we could do that with diabetes, then every time there was a message or a notice about diabetes, people would know that that's what is being talked about, and the messaging would be more impactful and effective. We are developing a message and a brand with this new vital sign. So now the conversations in our communities and our families and our workplaces can go something like this. How are you doing with the 150? Or, you look great. What's the secret? Oh, 150? That sounds doable. Great work. Another benefit of 150 minutes of just walking a week is the triple aim of healthcare. The Institute for Healthcare Improvement defines the triple aim of healthcare as improving the outcomes of healthcare, improving the patient's experience with their healthcare, and decreasing the cost of healthcare. When you think about it, in this country, if we could achieve the triple aim or make a dent in the triple aim, we would be well on our way to solving many of our healthcare problems that face us. And look at what we can do with 150 minutes a week and the triple aim: improved outcomes, weight loss, lower incidence of heart disease, lower blood sugar, lower cholesterol, fewer medications needed, improved patient experience with their healthcare provider. Because now when you see the doctor, at least part of the visit will be focused on the successes achieved with that 150 minutes a week. And decreased cost of health, because now there are fewer visits to the emergency room and urgent care, fewer medications needed, fewer lost work days because of illness or needing to go to the doctor, outpatient surgery instead of long stays in the hospital, and if a patient requires surgery, they'll go into surgery in a more healthy state, which allows them to recover quicker, all decreasing the cost of health, and we're more healthy. I'm sure that many of you have paid some attention to your health insurance over the last few years, right? Change in plans, increased deductibles, increased co-pays. There are now models with health insurance in which, at the end of the year, if a person's more healthy and the cost of their care has decreased, there's financial savings. Those financial savings used to be all given to the insurance company, but now there are models in which that savings is shared with the insurance company, the employer, and the patient. Wouldn't it be great to get a check back from your health insurance company at the end of the year and be more healthy? Wouldn't it be great to be known as Healthy City USA? Look at those two words, Healthy City, and see what is in those two words. TC for Traverse City and Heal Thy City. Instead of the old way of going to the hospital, visiting our doctor, or taking a medicine, maybe we add to that chasing health, preventing disease with 150 minutes a week. Does that mean that we shut down our hospitals, stop seeing the doctor, stop taking medication? No, not at all. Those are all critical parts of a healthy community. But wouldn't it be great to see your doctor more on a hiking trail or at a Friday evening walk around the Civic Center than you do in their office? Then we'd be truly using our hospitals, our doctors, taking medication when they are needed. Is all this possible? I believe that together we can change the world. Change starts with me. And if I want to walk on water, I have to get out of the boat. I've stepped out of the boat. Will you join me?